Just take the pill, and you will feel a whole lot better, light as a feather, floating in the air with no cares. And you'll see things differently. No, it's not free, that's a guarantee. It's no big deal, here's your bill, just take the pill.
ADHD is not a diagnosis in itself, but is a basket of symptoms: impulsive, distractible, short attention span, etc. All of those symptoms mimic more than 20 conditions, and those 20 conditions are each treated separately.
ADHD is not a legitimate diagnosis by any medical standard. It's just a list of behaviors that require attention in a classroom. The pharmaceutical industry got together with some psychologists and psychiatrists and figured out the behaviors in classroom that bother teachers, that require attention, that indicate that the child is either bored or just not fitting into the classroom, and then convinced the teachers and the U.S. Department of Education and lots of other people that it was good to drug these kids.
ADHD has years of research, but I think we need a paradigm shift. I think we need to look at it backwards. What's the cause of these things, as opposed to, yes, we've got all this research, therefore it is what it is.
When you look at ADD and ADHD, there's really no scientific test to see if the person is having these issues. No MRI, there's no medical test, there's no blood test that's going to show that.
Nowhere in organized medicine is there another condition where you would treat without doing a good workup. By workup, we mean get a working diagnosis and then a number of alternatives that it could be. And that's the standard way they teach in medical school.
In any other aspect of medicine, we do diagnostic tests to see if you really need a certain type of medication. If you have high blood pressure, they'll give you a hypertensive medication. If you have issues with fluid accumulation, they'll give you a diuretic. But with the psychiatry, and especially with ADHD in children, there's no real test. It's the opinions of the individuals around them, how best to make this person behave. And there might be other aspects that need to be looked at.
You get a diagnosis, you get other possibilities. It's called a differential diagnosis. And then you test for each of those until you find out what the right diagnosis is. You wouldn't have somebody who came in with a potential heart attack and give them pain pills and just say, well, that'll take care of the pain. It's the same type of idea. ADHD does not exist as a disease or a disorder, but as a group of symptoms, and we need to find the cause for those symptoms.
ADHD is just a list of behaviors, all of which could be developmental in origin, all of which could be the teacher's problem, all of which could be the parent's problem, all of which could be the kid has an underlying physical disorder, all of which could be from a divorce in the family and the kid's now living with the mom, which is a common source of this kind of problem, where the mom can't discipline him and dad's not in the home on a regular basis.
There are a number of conditions that don't need any kind of medication. One would be giftedness. Gifted children are very sensitive to what their needs are, and if we can't meet those needs, then they become distracted and bored, actually, and all the symptoms of ADHD come out because of the boredom. They need an enriched educational program.
Some kids are very intelligent and very difficult to satisfy. To keep their attention, they need more creative things to do. And so they get bored in class, and they may demonstrate the fact that they are restless or they don't want to be there or stare out the window while the teacher is rattling on about a subject that they have no interest in. And so there's no scientific basis for then saying that that kid has a chemical imbalance in his brain because he's a straight A student.
Learning disabilities, because they have learning disabilities, the same thing applies. It's hard for them to focus. It's hard for them to pay attention. If they don't get it and they're sitting there, they've got to do something. So they fidget, they get distracted, and so forth. Learning disabilities are probably one of the more common causes of ADHD symptoms. And if you treat the learning disabilities, it's no longer necessary to give them something to treat the ADHD.
You need to look environmentally as well, if there's other aspects in the family life that are causing the child to act this way.
The most common situation that I find is when I'm looking into the family life of a child who's been diagnosed or carries the misbehaviors that could allow him to be diagnosed as ADHD. The most common, not the only influence, but the most common one I find is that the child is the center of the universe. He has just quite simply, he has been treated such a way that he's allowed to come up with that conclusion. His parents don't know when to say no, how often to say no. They have often mistakenly believe that they are helping the child when they are either giving in to him or helping to solve his problems, doing things for him on a regular basis that he could do for himself. And so it's easy to develop the notion that I'm a pretty important guy and I should be treated well by others and I should even be the center of the universe. But then one day a child goes out to the child care center or the kindergarten or first grade, and what we find is that other people are not so quick to award him a special place or 80% of the attention or whatever. And so he finds ways to gain that attention that we would call misbehavior, clowning around, doing various kinds of things that are not so acceptable, and they meet the diagnostic criteria for ADHD.
Vision problems, where they can't see the board well, and therefore they get bored with the lecture and they start poking and fidgeting and being distracted. Or hearing problems, which could be as simple as wax in their ears, but could be more complicated hearing problems, but not such a big deal that people would outwardly recognize it. Except when the teacher's talking, they're distracted because they can't focus, since they can't hear well what's going on. In anemia or low iron, because they don't have enough iron in their system, they tend to be distracted, impulsive, have a short attention span, tired, and that can create a lot of the same ADHD issues.
When children start acting up and they have ADD and ADHD, there can be other underlying factors that may be causing this, and so medication probably is not always necessary for these children.
The pediatrician performed a 5-minute consultation and immediately wrote a prescription for psychiatric drugs for my son.
I find that there is such a loose willingness by primary care to administer medications for the condition without actually establishing a concrete diagnosis. If we follow the guidelines established, there are very significant guidelines that have and criteria that have to be met before the diagnosis is made. However, over the last 20 years or so, it has come from extensive consultations and testings and before you label with a diagnosis, to the point where it's just a 10-minute conversation with your primary care pediatrician, and they have the right and the willingness to start you as a trial on a medication.
What happens is there's not a lot of time spent actually looking to see if there's other environmental factors that might need to be addressed to make the situation be resolved. The medication management, because of time constraints today, basically the person goes into the office, they have a 5-minute talk with the doctor. How are you feeling? Same, better, no. And then they make an adjustment on the medication and they send you out.
It's a real difficult situation because doctors' time is limited. And what I'm asking is that they spend a fair amount of time making a diagnosis. They could look at the DSM-5, which is the new book, look at the checklist, see what's there, and use that as their checklist diagnosis and treat from that. They're going to make a lot of mistakes that way. And while they're treating, they're delaying the right treatment. And so the treatment delayed is really treatment denied.
There is a very loose willingness to diagnose and prescribe from the primary care aspect. And that's unfortunate because that is the door to the abuse. There are millions of kids that are going to be open to the abuse of these drugs simply because the doctor's signature is trusted.
This whole thing started when my son's guidance counselor stated that he had ADHD.
I have noticed that teachers are very quick to diagnose the problem and quick to say, oh, your child has ADHD, and they've even said this directly to parents. The problem with this way of thinking is that more often than not, there are other factors contributing to this type of behavior.
When the school told me that there was something wrong with me, I was surprised. I have never really heard of such a thing, and I didn't really know what to think about it. It was just different.
I was notified that I needed to meet with the school concerning my son. I had no idea what they wanted to meet with me about.
When a child has trouble sitting still and turning in their assignments on time, one of the first things that comes to mind among school counselors, teachers, and administrators is the possibility that the child has ADHD. This is supported by the school culture, with the next step being setting up a parent-teacher conference.
Sat down with this first grade teacher, and she showed me his grades, his academics. We had no reports of anything negative up to that point. And she tried to convince me that she felt that my son had an attention span problem and that he was hyperactive.
At these meetings, ADHD is always on the table.
I was pretty shocked at that. My son, he's academically, behaviorally, athletically, a good kid. Very good grades. And at first I didn't know what to think about it. And listened to what they had to say.
If a child is in conflict with parents and teachers, and that's what this is about, the lists of things like interrupts the teacher when talking, talks out of turn, squirms in seat, won't pay attention. These are conflicts in the relationship between a child and perhaps the parent or the teacher. To blame the child for that conflict rather than taking adult responsibility is to victimize the child. Instead of the teacher saying, I have 2 or 3 kids who really are uncomfortable in my classroom, I need to find a way to address their needs. Instead of taking responsibility for our children, we blame our kids and drug them.
I was notified by the school again to have a meeting. I went in, and when I entered the conference room, I was greeted by the school principal, his first grade teacher, his kindergarten teacher, and the guidance counselor. And it was just me. I looked at this and I thought, okay, I have 4 people sitting across the table from me. They're not telling me what this is about before I walk in. And got the feeling that I was, they were trying to set me up for an ambush.
It is common for the teachers to talk about the problems with the students with the teachers from past years and teachers where the students are going to in the following year to tell them what they're going to face.
During the meeting, it was suggested that my son did have ADHD. And the most common treatment for ADHD is a physician medicating the child. They tried to convince me to have them supply a physician that would come in and observe my son in the classroom every day. This physician was supposed to fill out a checklist, make observations, and then a similar checklist was to be given to my wife and I so that we could do the same at home.
I have to respect that teachers see the children of the same age in a classroom, and we can use their observations fine, but we have to also remember that their tendency, depending on the school, for instance, in a big city, there's more than 30 children in a classroom, and the teacher's tendency is to keep them all in the center of a bell-shaped curve. It's hard to deal with outliers who are normal at one end of the curve, being a little bit slower to learn, and at the other end of the curve being a little more gifted. It's hard for that teacher to handle all that in the classroom time that she has to teach, or he, a history lesson or a math lesson or what have you. And so when somebody is outside of the bell-shaped curve, they frequently, if they haven't had experience, will refer them to the doctor and say, maybe they have ADHD, think about that. And then the parent is thinking about it, and then the doctor is handing them this questionnaire, and they run into trouble.
My feeling was they were going to possibly approach me about my son going into the accelerated program for academics, which they have in this district. His schooling is very strong at home, and his grades are very strong. If anything, we felt our son was gifted. Academically, he would just chew through the material, master it, and want to move on.
Sadly, it can be in the interest of teachers to have youngsters on medication because it will have an impact. It will make youngsters quieter in many cases and not show the symptoms that can be disruptive. But the professional teacher has the responsibility to learn techniques for winning the cooperation of youngsters in the classroom.
After that meeting, the school seemed to want to target my son as a pressure tactic to try to convince us that we needed to get on board with their program.
I did feel like I was being treated differently. She would pay more attention to me in class than anybody else. My behavior was no different than anybody else's. It was pretty much normal. My grades were pretty much the top. I got A's, nothing less.
Surely, the only professionals that even possibly might get involved in using the words ADHD would have to be up at the medical level. It can't come from a classroom teacher seeing them. It can come from a counselor seeing. We're an administrator. We're not medical. We're not from the medical profession.
Academically, athletically, socially, I couldn't ask for better. And I feel just very lucky to have him for a son. As time went on, what we come to find out is many other parents in the area were approached the same way.
I don't think I would need to take a drug to do better in school. I just think that's baloney.
It's almost as if it's a fashionable thing to be diagnosed as ADHD or to have your child being diagnosed as ADHD.
ADHD symptoms have become very popular, and the word goes around with school kids, particularly high school children, that if they take a stimulant, they can do better in school. I certainly had a roommate in medical school who decided that was a great theory, and he took a stimulant so he could stay up late and study for a big test the next day. In the middle of the night, he decided he was having a heart attack and ended up at the hospital, which was really just a side effect of taking a stimulant that he didn't need. The children come into the doctor with the idea that they want the stimulant, whether they want it to do better on a test, to do better for their college grades, to do better on SAT or ACT testing or whatever testing is coming up, that they go to the doctor and they ask for this medicine.
Senior year, son came to me telling me that he had some problems. He thought he had ADD. And as a loving father, I had every intention of wanting to help my son. So I listened intently as to what his issue was. I questioned it highly because he was getting straight A's, was a trumpet prodigy, never once a call from any teacher, from any institution, from anything that he had been a part of, telling me about focus issues or concentration issues. And really the claim of ADD came to me as quite a shock.
If they go to a decent doctor and they say, this is the reason I want the medicine, they're not going to get the medicine. And so they learn pretty quickly to adjust, and they'll go home and they'll do 10 minutes of research and come back to a different doctor and say, I can't focus, I can't pay attention. I'm having all these racing thoughts, and can you help me, doctor? And of course, then they get this checklist, they check everything off, they get their stimulant.
He would learn the buzzwords, and he was shrewd enough to be able to try to beat the system by telling all the ADD supposed symptoms, all the anxiety symptoms that he learned that would get him basically the drugs that he wanted to.
They're not going to do better because it's just, you either know the answers or you don't know the answers. I don't think getting focused for a test is going to help that much. But it's dangerous because it's not a good, proper use of medication.
My son informed me, said, Dad, I really don't want to take the medication. It doesn't help me in school.
All the studies that have ever been done have failed to show any effectiveness. It's quite a bizarre situation. The drug is used for months and months at a time, but there is not a single study that shows that there's any positive long-term effect from these drugs. And that includes academic performance, personality, social abilities, behavior. There's no evidence that anything improves. The only thing that happens is that for the first 4, 5, 6 weeks, you get a suppression of behavior. So naturally, the rating scales, particularly on the part of the teachers who have the kids confined, are going to show some improvement for a few weeks.
We doctors get into the mode of try this, try that. Everybody would have a good reaction to a low dose of stimulant when they first take it. They get very encouraged by the fact that, oh, my goodness, it's like a weight has lifted off my mind. It isn't long before they go back to the doctor and say, well, that great feeling is gone. And so the doctor will then raise the dose and raise the dose each time they call back until they decide, the doctor and the patient decide that they need to try a different stimulant. And so they'll go on to a different stimulant, starting slowly and raising the dose. And the point of all this is that it isn't going to work for most patients.
The child came back to school, and they would just continue to experience problems. The parents would be called, and the parents would say, well, I'll talk to the doctor about it. And we would hear that the medicine has been changed, or perhaps another medicine has been tried. And this continued to go on and on and on and on.
Strattera was the first psychiatric drug that was prescribed for my son. My son originally started off with a lower dosage. Every time my son would forget a pencil or homework assignment, the dosage would be increased for his psychiatric medications. Went up in the dosage, didn't achieve the desired results, they changed the drug. they switched my son from Strattera to Concerta. On the new drug, my son started off on lower dosage and then increased over time. Eventually, when that didn't work, increasing the dosage, they switched to medication again. The latest medication they're giving my son now is Vyvanse. They started at a lower dosage of Vyvanse and increased the dosage over time.
You have to realize that every time that you make a medication change, you have to reach what's called steady state. In pharmacology, it means that the multiple doses build on each other and then it becomes a consistent blood level. And for different drugs, that takes different amounts of time. So sometimes they might not even be getting the full effect of the medicine when they actually have their follow-up visit.
It's like an art of trying to experiment with the children while you try to figure out what's tailor-made for this child, a regimen of medication that will fix the problem.
Some kind of experiments. It's like our kids are lab rats, guinea pigs.
They'll do that to chimpanzees. You know, chimps are like little kids. They want to play, they want to run around, they want to groom, they laugh, they hug, they get into little tiffs. And if you give chimpanzees the regular amphetamine and Ritalin-like drugs, the chimps stop doing things. They even stop trying to escape their cages. And then they get what's called stereotypical behavior. They just persist at some obsessive, useless activity like gnawing on bars or playing with a pebble or staring into space. And that's what the drugs do to our children. You know, if you think about the chimps again, where, you know, the chimp who is on these drugs looks like he doesn't mind being penned up. And in effect, we're creating good little caged children. What the drugs do, very straightforwardly, is they suppress all spontaneous behavior. All the ADHD drugs, Ritalin and the amphetamines like Dexedrine, they actually crush the natural, imaginative, spontaneous activity of the child. First, they suppress their spontaneous behavior, then they enforce obsessive behaviors. So in a classroom, if a kid stops some of his behaviors that are annoying the teacher, like talking to the girl next to him or poking the guy next to him, then it's seen as an improvement by the teacher, but it's actually a crushing of spontaneous behavior. Then when the little boy, it's usually a boy, starts copying off the board finally, the teacher thinks, oh, look, he's learning, he's copying off the board. But he's actually become obsessively obedient. He's not learning anything. And the one study that took a real good look at this out of NIMH said that, yeah, half the kids are getting OCD, basically, obsessive-compulsive disorder. And if you look at how they write on the paper, they're tearing the paper, they're bearing down. It's an abnormal behavior. So the drugs produce a series of abnormalities which harassed parents who are having trouble raising a boy, or teachers who are having trouble controlling a classroom like. Those adverse effects are the crushing of spontaneous behavior and the enforcing of obsessive-compulsive behavior. The teachers don't notice that a lot of other behaviors are disappearing, that the child's less social, the child cares less, the child looks a little fatigued and a little depressed. What they notice is the target behaviors. Yeah, he's talking less, he's interrupting less, he's actually less spontaneous and in a sense less alive.
Just because a kid is on meds does not mean he's going to sit still and turn all his assignments in on time. What I have noticed is that they become more quiet, more subdued, and their spirit has gone out of them.
I see people all the time, since I see them in referral, and the children come in with the idea that I took this medicine, it didn't help me, I'm just dumb. And now I've got some baggage to deal with because of the failure of the medicine that they were told is going to take care of their problem.
There are so many adverse effects that you have to start wondering if you're doing more harm than good.
There's suicidal thought associated with stimulant medications, and there's depression as a secondary result of the stimulant medications.
These drugs commonly depress children. There are studies showing that 2/3 of children will have some degree of lassitude, apathy, depression. It varies from study to study, but it's very common for amphetamines to depress children.
Depression in children doesn't act like adults in that they don't become sad and want to lay around. They actually get unfocused and fidgety and poke other kids, and they're easily distracted, and they don't want to do their work, or they rush through their work, and that checks off all the things that you would find in a checklist for attention deficit hyperactivity disorder. The problem there is that if you then decide it is an ADHD and treat them with stimulants, since we're going to go through this, try that phase that most doctors use, one of the side effects of stimulants is depression. So then they get a double whammy. They get depression, and then they get more depression. And there's a big, what we call a black box warning on stimulants that says it may cause suicidal thought. And by black box warning, you have a list of side effects, but if they want to put emphasis on any particular side effect, they put it in a black box to give a stimulant to a depressed person where depression is going to compound. The idea of possible suicide is another side effect, dangerous, obviously, side effect.
I've experienced a lot of kids, mostly teenagers, that have presented to the emergency room with suicide attempts. Almost all the children I've seen with the suicide attempts have been on one or more psychiatric drugs. No child has died from ADHD per se, but there have been many reports of associated deaths related to the rampant abuse of amphetamines. Children have died from amphetamines. Children have suffered multiple side effects which are difficult to handle, with multiple drugs being administered because of them, not because of the primary condition that they're in. One has to wonder if we're doing more harm than good by administering these medications.
Some of the side effects of stimulant medications are trouble sleeping, trouble eating, not being hungry, not gaining weight.
The side effects that can be very possible with the psychiatric medications that are being used for the children for ADD and ADHD are insomnia, weight loss. More troubling would be cardiovascular, where the heart becomes enlarged, and as a result of it can lead to heart attacks.
The drugs raise blood pressure. They're a risk for cardiovascular arrhythmias and death, not frequent, but disastrous potentially. One of your first big problems is going to be addiction, because it changes the child's brain. When you want to think about the adverse effects of Ritalin or amphetamine, think about methamphetamine and cocaine, because they're all in the same class of drug. This drug is, in its basic chemical effect on the brain, basic effect, almost indistinguishable from cocaine and methamphetamine. You can see that long-term it's going to encourage the use of methamphetamine and cocaine. And studies show that children put on Ritalin who have been diagnosed ADHD compared to children diagnosed ADHD and not put on Ritalin, the kids put on Ritalin have a higher rate of cocaine abuse as young adults. That's a fact. It's a very, very good studies that show this. These drugs produce psychosis. The FDA acknowledges a small percentage, but they're actually the good studies that look back at the kids given these drugs. Up to 10% of them will have some sort of psychotic-like symptom during their exposure in a routine clinical treatment. Now, what we're finding out from long-term studies is that diagnosing a child with ADHD and putting them on supposedly the milder of the drugs, the methylphenidate drugs or Ritalin, Concerta, that diagnosing a child with ADHD and putting them on these drugs over a 30-year period produces increased incarceration for criminal behavior, increased mental hospitalization, increased psychiatric drug exposure, increased suicidality, decreased income and decreased educational achievement. Well, why is that? Well, the folks who do these studies would like to say, oh, that's ADHD. But the kids in the studies had no serious behavioral problems at all to begin with. So what's really going on? What's really going on is that diagnosing a child with ADHD and giving them a stimulant drug is a gateway to a career as a mental patient. And the reason these kids are ending up as adults who have so many terrible problems, the reason is that the definition of the child as having a mental disorder and the adverse effects the child gets from the drug lead to further psychiatric diagnoses and further drug administration, so that by the time the person is in their 40s, they're now on antipsychotic drugs, antidepressant drugs, and benzodiazepines and mood stabilizers. They may not even be on ADHD drugs anymore because they're now viewed as having a serious mental illness.
When a medication's not timed release, we consider it immediate release. And so after 20 minutes in the stomach, it's going to be absorbed and you're going to have what's called a peak in the bloodstream, which means the medication is going to peak and then it's going to start dissipating as it gets metabolized and utilized on the different receptors in the body where it's supposed to go. So as the day goes on, and if medication's not dosed at another time, what can typically happen is a withdrawal of the medication. And the withdrawal can look like agitation, confusion, and when people start withdrawing from the medication, it can almost be like withdrawing off of regular drugs like narcotics. These symptoms can be really severe and can be very troubling for the family.
Many children will have it wear off in 3 or 4 hours and then need a second dose. So you've got a peak and then a valley and then a peak. So it's like jerking their system back and forth. Extended release medications make less peaks and valleys, but it is still a stimulant medication. And if the stimulant medication is not the appropriate medicine, then it certainly will cause the same addictive properties as the short-term medications. You may also need to keep raising the dose of the extended medication until you realize it isn't working.
With the treatment of ADHD and other behavioral disorders, one encounters side effects. The side effects sometimes need to be handled as well, and so these are handled by prescribing and dispensing additional medications that would try to nullify the side effects from the primary medication. This ends up putting the patient into a multi-drug situation, which is difficult to predict because for every drug you add to the regimen, you are potentially adding 3 or 4 or more side effects, which are listed many times as a disclaimer by the pharmaceutical companies. So they will say, if you get a heart attack, we told you so. It's written right there, on your disclosure when you get your medication. However, people seem to ignore that and continue to take the multi-drug regimens, and that puts them at risk. We tend to want to achieve one particular effect with a drug and not realize that this is a chemical that's far into the body and it's going to affect many other places or many other physiologic processes. Amphetamines cause insomnia, so they'll give a benzodiazepine like Valium or so for sleep as a sleep aid. And this creates other side effects like lowering the blood pressure. So they have to watch out for the patient's blood pressure problems. It throws them into a never-ending sort of circus of trying to catch up with what medication is creating what effect and what side effect and which one is unwanted and which one is okay to have. It is not possible to predict how these multi-drug regimens adversely or beneficially affect these patients. And so it's definitely set up to fail, because there's no way to predict, what's going to happen when 2 or 3 medications come together and adjust or influence the normal physiology in the body.
It is not an innocuous pill. And to emphasize that, the government has required a different class of medicine for stimulants. So the government actually knows that this is a serious thing. A lot of people tend to take it lightly. It shouldn't be taken lightly.
I've noticed changes with my son on the medication. He gets fatigued, he's moody, he has a lack of appetite. I don't recognize my son's personality on the medication. He seems like a totally different person. His personality has totally changed. He's not my son that I knew. He's the physical body, but he's not there and appears to be a zombie. He's got glassed over eyes, he has mood swings, lost appetite, and he's lost weight. I want my son back. I want him off these drugs. I want my little boy back.
That's when the real trouble started with the psychiatrist. 3 months went by, and we saw a slow, gradual demise in his well-being. And I was stunned by the state that he was in, trembling, a tic in his face, weight loss, massive weight loss, probably 15 pounds or more in just a 10-day period, and paranoia, extreme paranoia. Couldn't even talk, slurring, just horrible. About 4 o'clock in the morning, we heard loud screaming, blood-curdling screaming in the middle of the night out in the family room. We all came out running to see what was the matter, and my son was there looking out the window, just screaming, extreme paranoia that someone was trying to break into the house. Incredibly bizarre and upsetting, disturbing. We have 2 retrievers that were there that bark at a leaf turning over in the backyard, and they were both laying there completely still and quiet. There was no one out in the backyard. He insisted at the top of his lungs that there was someone out there and someone trying to break in. And that was really one of our first clues. There was something deeply disturbing going on. Immediately went through his room and went into one of his drawers and found a litany of prescription bottles sitting in one of his drawers, to which we were stunned to see prescription after prescription after prescription of addictive drugs, Vyvanse, benzodiazepines, Adderall, temazepam. In just a period of 60 to 90 days, he's on all these drugs. So as I got my arms around all the pill bottles, I noticed that there was one doctor on all of the pill bottles, and the number was right there. I called the number really out of panic. There was more concern than anything else. I just wanted to know what was going on here. What had he prescribed? What was his thoughts? What was going on? And he sharply told me that he had been diagnosed with ADD. We learned some very shocking details. First and foremost is that the doctor that I previously mentioned had begun to write prescriptions for other people in the family. Unbeknownst to us, he was writing prescriptions for my son under my name, my other son, his older brother's name, my wife's name, my ex-wife's name, and basically ran through our whole family writing prescriptions. He'd never spoken to us. He'd never called us. He never even knew what we even looked like. And there were prescriptions written which we had all the bottles for with our names on them. When we basically shut the first doctor off through various means, he started doctor shopping, started going to the urgent care centers, which are plentiful here where we reside, from doctor to doctor to doctor. And it was almost like a chase movie that we would get the notice from the insurance company a day or two later that this claim had been filed or this or that. And I would literally follow these claims around, going from urgent care center to urgent care center and trying to find out how these things could happen. He would walk into one doctor and literally leave there and go right up the road to another urgent care center and get the exact same prescription for the exact same amount of medication, and then go from pharmacy to pharmacy to pharmacy. These drugs were doing him no good. In fact, they were going just the opposite way. Again, we kept hoping and thinking that he was on his way to reaching rock bottom until I got the phone call from the police officer telling me that my son was going to be arrested the next day, that they had been tracking him at one particular pharmacy where a red flag was coming up with a patient who was coming in trying to get too many prescriptions. He had put in a high amount of benzodiazepines, all the ADD drugs, Adderall, uppers and downers, basically. He was taking a bunch of uppers to cure his quote-unquote ADD, and then he had to have downers at night. He was so hyped up at night he couldn't go to sleep. It just came out of a need to continue to up the prescription, to up the dosage, to up the amounts. And it was never good enough. One, if I can take one and feel a little bit better, why don't I take two? And if two make me feel good, well, why don't I take four? And his insatiable need to have more and more and more. He went to jail. The judge put him in for an extended period of time. It ended up being 6 months. And we felt that 6 months, again, looking for that magical rock bottom point, we thought that was it. How can it be any worse than that, to be in a cell for 6 months? And that fateful day came when the judge released him, and I went to pick him up, and out he comes, sheriff escorting him, and handed me a shoebox and announced that these were his meds that he was on. Stunned, after 6 months in jail, thinking that this was the way to get him clean and to get him off all these drugs, I found that he was on more drugs while he was in jail than he could have ever gotten while he was on the street. The sheriff's office, the government, the state had led a psychiatrist, again, with a guy that shrewdly beat the system time after time after time after time with all the right buzzwords. He went into jail and gave all the right words to the psychiatrist in the jail, and lo and behold, he comes out with more drugs than he was on when he was on the street. We found a place for him to live away from home, breaking our hearts to not be able to have our son welcome in our own home because of the situation, and led him to the ER room. He was involuntarily committed from the ER room to a program that we have here when you're a danger to yourself or to society as determined by the police or a close family member. And for the first time, we had to heartbreakingly commit him to a psychiatric evaluation and automatic 72-hour detox, if you will. Since the initial involuntary commitment, we've had 4 more, 5 in total now, and the last one was really chilling. He was out on the street, had picked him up to try to see what we could do for him yet once again, going through this now for multiple years. Picked him up in a parking lot, got him a bite to eat. He jumped out of the car and pounded on the car in front of him while we're in a fast food drive-through, just waiting for our order to be picked up. Drove a couple of miles down the road and driving 40, 45 miles an hour in the left-hand lane, and the door flies open, the passenger door flies open. And he's screaming now, just incoherent, screaming, I can't take this, I can't take this. And he's going to jump out of the car. He tried to jump out of the car at 45 miles an hour on the pavement. His foot got stuck. He couldn't get out of the car. And I immediately downshifted and slowed down and tried to get off the road. He jumped out of a car at 15 to 20 miles an hour and did quite a header. And there was my son rolling along in the dirt. As I looked at him in the rearview mirror, I called 911. Thank goodness 2 police officers were there within minutes. They asked him to stand at attention, and he dropped his pants. And he had no skivvies on, so he's standing there basically nude from the waist down, facing traffic. Heartbreaking as a dad. Just one of the worst things that I could ever really think about is seeing my son standing on the side of the road, naked, with 2 police officers standing there. So he was involuntarily committed. The police determined that he was a danger to himself, and they handcuffed him, put him in a police car, and took him off to the ER room. And all I could think of was, this is because he has ADD? This is attention deficit disorder?
Russell Barkley, a psychologist, is probably the most prolific writer about ADHD. And he has maintained that attention deficit hyperactivity disorder can be described by one symptom: an impairment in inhibiting behavior and delaying a response. An impairment in inhibiting behavior and delaying a response. Well, even though Dr. Barkley is a proponent of drugs, and you will see that that is not my way of looking at a solution to the problem, the definition is helpful: an impairment in the inhibiting and delaying response. Now, why do I say that? The truth of the matter is that we human beings almost always delay our response to stimuli, if ever so briefly, in order to reflect at some level of consciousness on options or inhibiting factors. But what I find is that children whose behavior meets the criteria for the attention deficit hyperactivity disorder don't have a lot of inhibitors to look at. They have what I would call an underdeveloped sense of social interest. What we find too often is that young people are not taught to be concerned about their fellow human beings, about the rights of mom or the rights of dad or the rights of others in the family or the rights of other children in the child care center or kindergarten. And to the extent that they don't have those inhibiting values to look at, it's a license to steal. The best way, I guess, to do family therapy would be to move in with people and really know what is happening. But second best to that, we try to understand a pattern of transaction in a family. And so I might ask them at some point how chores are shared in the home. And very specifically, if I'm not getting the information that I need, I might say, well, who prepares the meal? Well, Mom says, well, I do. And I say, and then who sets the table? Well, I do. And then, well, who clears the table? Well, that would be me, says Mother, you know. Or maybe Father chimes in and does some of them. And who washes the dishes or whatever? Or who takes the trash out? So when you look at a specific list of responsibilities in the home and you see only the adults' names showing up there, you've got trouble. We've got people who are in a free ride who are learning that other people should see that things go well for me. Whoa, that is not what we want to teach our youngsters. I mean, the greatest hope that we can have for living together peacefully and happily in this world is that young people learn to make decisions with a view towards, is this a help not only to me, but the rest of the people who will be impacted?
In children, in adults, you need to look for root causes, and usually they're there. I've looked back over 5,000 patients, and I found that if we treat the main condition, be it a mood disorder or sleep problems or learning disabilities or giftedness, that you don't need to treat for ADHD, because if you treat the primary cause, the ADHD goes away. There are many people who present with ADHD symptoms that are not pathologic. And people will frequently call me and they'll say, okay, I have all these things on a checklist. What do I do? And the first question is it causing pathology? In other words, is it ruining your life, your academic life, your social life, that type of thing? And if it isn't, then there's still things to do, but you certainly don't need medication. So exercise and a good diet help with this. Not a lot of junk foods. A good amount of sleep by and far helps, People do play video games into the night and end up having symptoms because of that, because of the sleepless syndrome. Having a good night's sleep, and that varies by age, but young teens need a little more sleep actually than younger children need. When they're sleep deprived, the symptoms are even worse.
Prior to ADHD being on the table as a diagnosis, back in the 60s and 70s, during my first 15 or so years of teaching, when I had a problem in the classroom with one of my students who wasn't sitting still or not turning in all his assignments, I directly called the parent myself. At this time, we developed a plan of action together, which might have included a close monitoring of the student at home, a series of rewards and punishments being activated on both sides of at home and at school, and at this time, even perhaps getting checked by the doctor or checking his nutrition. The problem usually went away.
I was actually sitting on the back porch of my brother's, and we were talking about, just how much medication is taken from young kids. And I just was thinking, man, this is almost, it appears like I'm living in zombie land in a sense. At the time, this was in 2007, 50% of Americans were on some sort of a medication. And that just stirred me beyond words. And the rest of the pill just kind of fell from the sky, basically. It's really bothersome, really, to think of how much of our kids are taking medication. I think a lot of medication is basically, used for our kids that really don't need to be.
The practice of medicine over the years has changed in terms of the dynamics between the patient and the physician, the relationship. The physician has moved from a trusted decision maker as far as disease process and management of treatment and cure to one of a medium or a way of getting medications. The dynamics has shifted because of direct marketing by the pharmaceutical companies to the consumer, who in this case would be the parent of the children or the patient themselves. And this direct marketing has resulted in patients showing up at the physician's office already pre-diagnosed and ready for their prescription. And in which case, the physician finds it an uncomfortable situation. Needless to say, the majority of them may appease the wants of the patient or parent and go ahead and give a prescription, which they might have second-guessed before. We've lost control as physicians of medical practice. First it was to the insurance company, and now it's to the pharmaceutical companies, because unfortunately we're being bypassed because of this marketing strategy and the infusion of concepts into society, which makes the patients seem to be aware or seem to be knowledgeable about what their conditions are. I think the only reason people show up to the physicians now is because they legally need a prescription, because they've got it all figured out. The ads are on the TV. They read a lot of literature. They can go online on WebMD and they can, decide, I've got that disease and I want that medication. Society itself is going down the tubes because we're creating a chemical society where everyone wants a crutch and nobody wants to have coping skills anymore. It's just, I'll take a pill for that. But now the big push is a pill for your mood or dial a new personality, and so it's a runaway train. However, once you start these medications, the curious thing is that there was no promise as to when you could stop. So the kids that were placed on it tended to be sentenced to a lifetime of medication.
There's so many problems with this class of drug that I believe that in a rational society they would be banned. We just shouldn't be giving these drugs to children.
They've got meds for any and everything you need. There ain't nothing you have that they have not seen. With a wink and a smile and a pat on your back, you might have yourself a little heart attack when they ring you up and send you on your way. You hear them say, just take the pill and you will feel a whole lot better, light as a feather, floating in the air with no cares. And you'll see things differently, though it's not free, that's a guarantee. It's no big deal, here's your bill, just take the pill. Little money, buddy, will never get you through the door. And if you get inside, you wish you would have brought some more. Cause they get rich off sickness and pain, while the working man simply goes insane. If there's a brand new epidemic, but they've got what we need for a small fee. Just take the pill and you will feel a whole lot better, light as a feather, floating in the air with no cares. And you'll see things differently, though it's not free, that's a guarantee. It's no big deal, here's your bill, just take the pill. Wish I could take that day back when I gave in to my friends. They said they want to take me to a place, yeah, where I've never been. It's been a long, long journey since then. Temptation still blows in the wind. Lonely days are what I fear. Yeah, the devil whispers in my ear. Just take the pill and you will feel a whole lot better, light as a feather, floating in the air with no cares. And you'll see things differently, though it's not free, that's a guarantee. It's no big deal, here's your bill, just take